Hello you guys, welcome back to my channel. For those of you that don't know me, my name is Melisa Rodriguez. I am a first year medical student at FAU and I make videos about my medical school journey. I am currently in residency application or residency interview season, so that's why I'm dressed like this. I wanted to just make the video now that I have a little bit of time. I have been quite absent from YouTube lately, but I love creating these videos that cover stuff that it's important to me, and I still want to continue creating these videos. So today I'm coming back hopefully with something that's interesting to you. It's very important to me what I'm gonna cover today, and you guys will see why. Just wanted to share a little bit more of my input in patient care. This is gonna be a video about empathy. How do we show empathy to our patients? What constitutes empathetic care? All of that. This is even more important to me than, doing well on exams or learning all the technical aspects of the profession, which you learn as you go, right? But being empathetic towards patients and, showing that you care, it's one of the main, if not the most important part of the job. We're dealing with humanity. This is service to humanity. And if you want to go into medical school, or you are going through medical school right now, you may know how important this is. It is true that for some people it becomes really difficult to do this. It can be different reasons. Some people are not as social as others, but I do think you can improve as you go, as you interact with more people, as you practice, you can improve these. But I did want to, touch on some things that I have learned through my experience, things that I have seen through clinical rotations that have given me good examples of what it is to be empathetic. So first, what constitutes empathetic care? So I wanted to talk about the definition, or at least what I think is the definition, is putting yourself in this patient's shoes, or in this person's shoes, and considering everything that they're experiencing. How would you feel if you were in that situation, so that you can, take a step back and understand the intensity of the feelings that they may be having. In the hospital, you're taking care of very sick patients that don't know what's gonna happen. There's a lot of uncertainty. Patients that maybe perhaps they've been dealing with this illness for years and years. So it is your job to come in with a comforting attitude, to kind of help them at any step that you enter their care. And I think empathy is also taking the time to listen to their concerns, their points of views, and what matters to the patient. In geriatrics, specifically, I learned about the 5 M's. They consider in geriatric patients, but you can apply to anybody, the 5 M's, which include medication, mentation, mobility, multi-complexity, because geriatrics patients usually have multiple comorbidities going on, and lastly, what matters. So one of the 5 M's is what matters. You ask the patient, because in most of these patients who are very sick have already so many other diseases and medications that they take and things that they're dealing with. But what specifically made them come into the hospital, or what specifically is causing them the most trouble? What matters for them to fix at this point, or what are the things that are more bothersome to them? So empathetic care also constitutes getting to know your patient. You want to focus on doing a really good social history. I cannot emphasize this more. You can ask the patient, where are they from? Do they work or study? How are they like at home in terms of function? What are they able to do before they got here to the hospital? So that you can prepare yourself to take them from point A to point B, to see their expectations. How were they before, to understand, the change that they're going through, coming to the hospital and having to go through this traumatic time. You want to know if they're having social support at home, if they have people that check in on them. Who controls their medications? Do they have family around? Do they have transportation? What are they like outside? And this is not only for the sole reason of being nice to them and, you know, building rapport, which is important. But also it helps you on your treatment plan, because you cannot make a treatment plan without the patient also being in the same page and being able to do it. So you need to know what they're gonna be able to do after discharge. So it helps both in building patient rapport, which is gonna help you build a trustful relationship with the patient, and on your treatment plan to see what are these, what part of our plan is realistic for the patient to complete. Do we need to change medications? Do we need to, you know, alternate some things so that they match each person? We have bread and butter cases in internal medicine. This is why I love internal medicine, because even though we do have bread and butter cases where you know, they present similarly, every person is different. So you need to consider social determinants of health. You need to consider everybody's specific situation when it comes to their treatment plans. They may differ at that point. You need to know. It's a very social specialty. So now I wanted to talk a little bit about examples, right? What are characteristics that made me know? I have seen a lot during this last 1.5 years of being, you know, full-time in the hospital or in clinic. I have seen examples of very good bedside manners, very good patient care, and I have also seen very bad cases. So I want to just touch base on what are specific examples or ways in which you can demonstrate empathy to your patients. And it all kind of comes to one one bucket, which is communication skills. Everything comes around communication skills. From the first time you interact with your patient, the introduction, they're meeting you for the first time, you need to be open to listen to them. Entering the room, cleaning your hands, using gloves, all of these means that you care about the patient, not about yourself only. Making sure that everybody in the team is doing the same, because the priority once you enter a room is the patient, how they're feeling, what process are they going through, you know, starting with open-ended questions, getting to know your patients, but at the same time remembering the important questions that you need answers to, right? You don't want to spend so long in the room, but you also don't want to make it seem like it's pushed, like I'm trying to get out of here really quick, right? So you need to give the patient the time they need to express themselves in their own words about their understanding of their condition and about what's going on and what are the next steps, right? Update the patient. What is your input from your assessment, right, after you finish everything? And then you need to make sure they understand and all questions are answered. So one example is the introduction, right? Being really nice in your introduction, introducing yourself and all of the members. You don't want to introduce yourself only, because there's also probably more people coming in with you, especially on rounds of internal medicine. They often there's a lot of people involved, and you want to just be simple, open, and allow the patient to talk. That's a good introduction, right? Then good bedside manners for me is sitting down to the level of the patient, because that way they feel like as you're spending more time with them. So if you sit down in the chair on the side, or if they allow you on the end of their bed to talk to them, I think they're gonna see that you're wanting to really understand what's going on with them. Okay, physical touch is another one. This is very clinician dependent and patient dependent. This is why you learn how to read a room. These are social skills, right, that you gain as you go. You read a room, see if the patient allows you, then you can just, you know, provide them with comfort as physical touch as well. I feel like it's really important because I have seen it in multiple clinicians, and I feel that it adds even more humanistic care in terms of like touching their arms, right? Even a hug when they're going through really difficult situations and the families are there and they're crying and everything, they may need a hug, and I am more than open to offer that to them. Another thing is providing reassurance in the form that a lot of people are hesitant to even come to the hospital or even seek help from doctors, because they feel like they're not doing their job correctly. So you want to provide reassurance that you are doing everything you can and you are there for anything that they need. by saying things like that. Is there anything that I can help you with right now? And by very simple things such as bringing a cup of water, bringing a blanket, arranging the temperature of the room, all of those many things that we can do before moving to the next room can just reassure the patient that you're there for them and that they're special and that they're well taken care of. You know, and saying things like one day at a time, we're here for you. And lastly, at the end of your interaction, saying, what questions do you have? Instead of saying, do you have any questions, saying what questions do you have takes off the pressure and just makes it so that it's normal for them to ask questions, that we expect questions from them, because all of these medical explanations can be overwhelming and a lot of times they don't understand what's going on. And I think it's important for them to know that they can ask any questions at any time, and even after we leave the room they can ask the nurses, they can, you know, reach out. That's, I think, very, very important, because this is service. The patients have the right to understand everything. And touching on that point, they have the right to know everything, as well as sometimes they can choose not to know things. So especially in end-of-life conversations or end-of-life situations, it's important to ask the patient, what do you know already about your condition? And what do you want to know? Do you want to know all the details, or do you want to know just a summary? How much do you want to understand? Do you want us to discuss this with any other members of the family? All of these things show that you care. It's like putting the extra grain in the salt pocket so that they feel like they're in control of their health. But it basically, yes, all encompasses that, because you want the patient to understand everything, and this is language as well. As physicians, we want to know the medicine, understand the medicine, but also being able to communicate it in simple terms that our patients can understand, so that patients can explain to their family members. I don't know if you ever had people in the hospital or you know, loved ones that have been through difficult times. You want to understand everything that they're going to, and how can they explain it to you if they themselves don't understand it? You want to make sure your patient is, you know, educated on their illness, so that they take control of it, because the less control we have of things, the more overwhelming it can be for us to deal with this difficult situation. So you want to give the patients all the tools that you can provide so that they can deal with their illness. But I hope you learned something or gained something useful from this video, and I appreciate that you watched till the end, and I hope that there's more people that put importance or emphasis on this topic, because it is important, and maintaining empathetic care and demonstrating empathy in your mind all the time. So yeah, thank you for watching, and I'll see you in the next one.